Okay, we should be good.
Good.
Yep.
Okay, I hereby call to order the East Amwell Township Committee meeting.
Adequate notice of this meeting of the Township Committee has been provided by a notice sent to the official newspapers of the Township, posted to the Township website, posted on a bulletin board of the municipal building, and filed with the Township Clerk as required by law on January 6, 2025. Ms. Casper Bloom?
Here.
Ms. Enton?
Here.
Mr. Nardi?
Here.
Mr. Dendis? Mayor DePiero?
Here, will everyone rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, good evening, everyone. We have all the announcements listed in writing in the agenda that's been passed out. Some additional ones to note. Dave Barrick is retiring from DPW, and we want to thank him for his long service to the town, and we want to wish him well. Also, Judge Edward Martin, our longtime municipal court judge, has passed away. We thank him for his long service, and we send our condolences to his family. Also, on the EMS solicitation, as folks will remember from our last meeting, the town announced that it will be considering proposals for EMS providers for 2026. We have granted an extension for any interested party. 3 entities have expressed their interest in submitting a proposal so far. We had originally given 2 weeks only for providers to submit proposals, and it's the holiday season, so when we got a couple of requests for an extension, we extended the period for submissions until Friday, July 23rd at January 23rd, 2025. To make
26.
26. Thank you. I stand corrected. Friday, January 23rd, 2026, so that everyone will have a chance to be able to submit. We had a couple questions. One was about eligibility. So residents should know that the solicitation specification allows all of our local entities, that's Amwell Valley, Raritan, Lambertville, and other squads, including hospitals, to submit proposals. We also had some questions from the public about process. The process is going to be open and public, and all relevant factors will be reviewed on the merits. That's how we'll be conducting that. So those are additional announcements. So unless anybody has anything else, we're on to item 6 on the agenda, open to the public comment period for agenda items only, please. Would anyone like to speak? Yes. Tim?
So since you mentioned the rescue squad, it's not on the agenda, but since you mentioned it, I guess it is on the agenda.
No, it's not on the agenda, but you could speak at the second opportunity.
Okay, well, I have a question on the agenda. So on the consent agreement items, the budgetary appropriations, the transfers, are they listed anywhere? Is that document available to the public as to what the transfers are?
Yeah, they should be on the handouts in the back.
Oh, what's up on the board there?
It was posted on the website.
Okay, thank you.
Thank you. Okay, seeing nothing else, going once. All right, so we're closed to the public without objection at this point. Consent agenda, in terms of procedure, I want to move Resolution 2025-163, which is appointment of Planning Board Secretary to the consent agenda. It wasn't in the other place for any particular purpose. May I have a motion to approve Resolutions 2025-161 through 2025-163?
So moved.
Second.
Okay, all in favor? Aye.
Ms. Casper Bloom?
Yes.
Ms. Enton?
Yes.
Mr. Nardi?
Yes.
Mr. Dendis?
Yes.
Mayor DePiero?
Yes. Okay, item 9, approval of bills.
We need a motion. I forgot to put that
That's
on.
okay. May I have a motion to approve the bills of the evening?
So moved. Second.
All in favor? Aye.
Ms. Casper Bloom?
Yes.
Ms. Enton?
Yes.
Mr. Nardi?
Yes.
Mr. Dendis?
Yes.
Mayor DePiero?
Yes. Correspondence is listed, and that brings us right to item 11, open to the public. Yes, who would like to speak?
ask that you speak up a little.
Sure.
I'm not hearing most of what you're saying.
So we're open to the public at this time. If anyone would like to speak, just come up to the front lectern. Just let us know what your name is and if you are a resident of the township.
My name is Janice Grover. I'm a 101 Bound Station Road. I've been a resident of the township for 40 years. Been on the rescue squad for over 15 years. Live in a home my husband's family built 200 years ago. Have been involved with transporting hundreds of patients, assisting in the homes over the years. People you know, like the Bonds, Andy Reid, who was township official, was present at critical moments in people's lives. Being part of the rescue squad changed my life, gave me an opportunity to interact in the community in a totally different way. I think that changing the arrangement for the rescue squad would increase the times of response, reduce that personal interaction that's essential and is critical to East Amwell. I can tell you that when we arrive, there's the opposite of the white coat syndrome. Instead of people's blood pressure going up, people end up calming down, feeling that they have help and assistance in the community. I wouldn't be here today, my husband wouldn't be here today if it wasn't for the rescue squad, which helped save him when he was critically injured. So I just think that there's a need to consider something beyond the financial considerations. I also believe you've been elected to look at the best interests of East Amwell. I don't believe that changing the arrangements for the rescue squad is in the best interest of East Amwell, or that's why you were elected to those positions. And I would think that you need to reconsider your position. This old organization struggle. I've been a volunteer in organizations throughout the community. I'm trustee of the Grover Foundation, where we've worked with hundreds of medical students over the last 20 years. Essentially, having the privilege of working in the medical community is something that can't be replaced. The experience you get being on a rescue squad, being involved in a community. So that's something I thought was important to say. Thank you.
Thank you very much. Yes, would anyone else like to speak? Tim.
Well, thank you. And thank you, Janice, for your service to the community. Thank all of you who are participants. So at the last meeting, we had an interesting dialogue, both during the meeting, but at the end of the meeting. And I want to thank Deputy Mayor Dendis for hanging around and having a very frank discussion. And during that discussion, I tried to really, for my own understand what the motivation was behind the Township Committee looking into this. And I came up with two things. And please, as I'm talking, if you think I'm wrong, tell me, okay? One was there was some concern about financial governance of the current rescue squad. And that was the established reason for withholding $25,000 a year for the last 3 years. True?
Part of, for me.
I'm sorry, Mike, this is the comment period.
Okay, I just want to make sure I'm not saying anything that's not true. So like I said, if you think I'm not saying something that's true, please tell me. So that's one. The other is concern, which is a right concern, about response time and availability and the ability to provide the services to the community. I think we all care about those. But to take the first issue, when we talked about it, what I said is, well, what's the essence of that? And there was some discussion about people and that sort of thing I'm not going to get into. But there was a general sort of thought that if this audit was certified, this financial audit was certified, that would be acceptable. And I suggested, well, why not make the funds contingent on a certification? So, hey, we'll give you the money, but do a certification. And they, the rescue squad agrees it's going to cost them additional money, but, $15K or $18K is better than zero in my book. So that happened. Well, then I learned recently that the request for proposal was amended to remove the requirement of a certified audit. And again, tell me if I'm wrong.
I think you're wrong, but we'll comment later.
Okay, well, I've read it, and the requirement for a certified audit was removed. It was actually removed from the text.
Oh, I'm sorry. I spoke incorrectly. That was removed because otherwise our local squad wouldn't be eligible. So we
Well,
want them to be eligible. But
They would be eligible if they chose to do it.
No.
Yeah.
No, anyway, we wanted to make sure everyone was able to provide us a proposal. And because that seemed like, because they had not provided one before and said that they could not or would not, we did not want to just not include them just by the very qualification. So I misspoke now that I heard what you said.
Well, in my mind, that was originally a requirement, both of our local rescue squad withholding money, and then of the initial RFP that went out to vendors, and then it was removed. So my view is, it's no longer a requirement. So why not give them the money?
Thank you for your comment. I appreciate it.
I hope some of you have some courage to challenge the member here that has fixated on that issue. But in my view, there's no reason to withhold the funding for the last 3 years. Thank you.
Thank you for your comments. Appreciate it. Any other comments? Yes, sir. Thank you.
I am really confused as to...
If you just tell us your name and whether
I'm
you're a
sorry.
resident, we're trying
Kim
to...
Geis, 217 Mountain Road. Been here 40 years. Okay. I'm totally confused. I'm actually right behind him. Why make a change to something that's not broken? Or do you perceive this as broken? They've done a lot for our township. They attend things. They're everywhere. But I also didn't understand, out of 4 calls in 2024 for my husband, not one call went here. They went other places. Now, I didn't understand. I think I had 2 or 3 different rescue squads, but none of them were ours. And I asked about it, and they said, well, it has to do with the call center or whatever. And I'm thinking, I don't know, are they not even given a chance to come when we need help? I don't understand a lot of this, but it seems like maybe there's discussions that need to be made between the rescue squad and the township to come to terms, because it's in our best interest to have someone close by. And when that doesn't happen, I'm not understanding why the sudden change. And I'm calling this a sudden change because really we're not hearing about this until something loudly gets put out there. So if anyone can help me understand more of this, or shine some light on something that I don't understand, how it got this bad, and we're going to pay more. We're absolutely going to pay more. Not to mention, we're paying for them, the other ones, to come here anyway. So as a resident, I'm paying for them. It's not a volunteer. So maybe someone can help me with that.
Thank you. Other comments? Yes, I think you offered your spot to a lady.
Hi, Joe Wolfgang, 26 Zion Road. Lived in the town for about 27, 28 years now. 2 things I was thinking about, just hearing about the financial aspects of this. It's, I guess, kind of health-related, medical-related, and not to make this too political, but it reminded me of what's happening with the funding of Obamacare now, and how these additional monies are being held back, and it's people's health care the government's messing with. And the country's pretty rich, and the country can afford to extend those Obamacare subsidies to keep people healthy and have them know they can get insurance and get health care if they're sick, and be comfortable that they're going to be taken care of. And probably the U.S. can afford it. I think there's a parallel with East Amwell. In East Amwell, nobody wants their taxes increased, but the people, I think we have enough money to work with the rescue squad and make sure there's a comfortable feeling that there's a medical response that's going to be available, that's reliable, and maybe it means something very different. But I think to put uncertainty into the picture, and we just heard it sounded like a lot of uncertainty there with not knowing who's going to show up and when. It's not comfortable for people. And people, when they need medical help, they need it. They can't, you don't want to be sitting there wondering what's going to happen. Am I going to be taken care of? You're sick. And I have a personal experience with that. 13 years ago, I was on my motorcycle on 518 in Hopewell, and one minute I was doing 45 miles an hour, and the next second I was flying over a car that pulled out in front of me and launched like out of a cannon. And I was laying there in 518 just thinking to myself, I just want to hear sirens. That's all I want to do is hear sirens right now. And laying there for about 3 or 4 minutes before Hopewell Rescue Squad showed up, and actually Capital Health showed up as paramedics, but Hopewell transported me to Princeton Medical Center. And I went down afterwards, once things calmed down, and went down there and made a contribution to the rescue squad because I was so thankful those guys were there. It's a great feeling to know that and we actually, it sounds crazy, we had a couple of laughs in the back of the ambulance. So I think that human touch is very important. So that's it.
Thank you. Appreciate your comment. Yes.
Good evening. My name is Cheryl Watkins, and I'm 64 Old York Road, and I've lived here with my husband for 40-some years. And I'm very concerned, and I'm also very confused at what's going on. I'm reading very many different viewpoints, and I'm very concerned. Although my husband and I have not needed the medical service, we like knowing that it's here, and we've contributed financially, and hope that they know that we're supporting them. But I am totally confused at so many different points of view of what's going on, and I wish somebody could clarify that for me. That I'd be grateful.
Thank you. Anyone else? Yes, sir.
My name is Matt Dosh. I'm at 1026 Old York Road, and I've been in Ringo's for 21 years. And this kind of took me by surprise, the whole idea of this, and I'm confused as well as far as why they're talking about outsourcing it. I've been taken to the hospital by our rescue squad, my father-in-law, numerous times, and the response time has been excellent. But my father-in-law, who's 99, has also been taken by Lambertville Rescue and by Flemington, and the wait was much longer. And he's not as comfortable with people he doesn't know. And it's just a much nicer thing to know that your fellow residents are helping you out. If our rescue squad's here and volunteering to do the job, I don't know why we're trying. It seems like a slap in the face to A, withhold their funding, and B, not let them do their job. That's pretty much what I'd say. Thank you.
Thank you. Any other comment? Okay, so we're closed to the public at this point. So folks did reach out through your comments to ask for some clarifications, that there's at least some folks felt confused. So let me just start by trying to address that issue for you. So in terms of understanding what's happening, as we indicated at our previous Township Committee meeting, EMT services are critically important for our residents. When somebody calls for an ambulance, we have to make sure that they're going to get an ambulance there and to get it quickly. And that's, those factors are determined by a number of things. The ability of the squad to respond, the viability of the squad, so it's going to be in business, the squad's ability to raise funds so it stays as an ongoing concern, so it can buy the new equipment that it needs, so it can stay in business. Because again, this is critically important. And the state apparently is realizing this. The state, as I understand it, is in the process of passing a bill into law which requires municipalities to look at these issues and to make sure that there is EMS protection for their residents. But we started this before the state did in their legislative process, and we determined that because these services are so critical, and because we've had a number of years of questions where residents were raising issues about, including the ones that I mentioned, that we would handle the EMS providers issue the same way that we handle appointment of all of our other professionals in the township, which is we ask for proposals. We look at the proposals on a merit-based system, and we examine them for the best interest of residents. And wherever that comes out, it comes out. So we announce that public and open process to do it. So that's a restatement, a summary of why we're doing this. We're doing it in a professional way because it really matters to our residents. And our squad and other squads will all be able to submit proposals, and then you can come to the meeting and we'll look at the merits of what those are. I don't think that's a scary notion to anybody. In fact, you should find it reassuring that we're doing it in a merit-based, open process that's looking at the very factors that are so critical to our residents. Some other things, time of response is important. Totally agree with that comment. That's going to be one of the factors we look at. You know, we've asked for reports from our current squad, and we get them occasionally or from time to time, but not every month, saying, you know, how many could they respond to? What was the response time? We've also looked at the response time of Raritan and Lambertville when those folks have been essentially backing up our squad and doing mutual aid, which means if our squad's unavailable to respond to a call, those squads are called by that radio system. This is answer to your question, ma'am, so that somebody responds as quickly as possible. So we get to look at their data as well. That's what we've done before, but we haven't always gotten the data that we've asked for from our squad, but that's an important part of when we go into 2026, making sure that we have all that data for whoever's providing it. The comment that residents feel reassured when EMT folks show up that are professional, we totally agree. That's going to be another factor that we look at in terms of making sure our residents are getting good services. Looking at more than just financial issues, totally agree with that comment as well. The Township Committee feels that it's not just financial. The issue is good quality care, reliability, viability, all of those things that we talked about. So we're going to look at definitely more than financial. We, as a township, may have to pay money because costs have been going up. But we can look at the cost proposals in each of the providers that provide their proposals to us. So it'll be something that'll be looked at, and all of you can look at it as well. Audited financials. Every rescue squad I'm aware of nearby is required by the municipality to provide audited financials. Why? Because public money from that municipality goes to a rescue squad, and those taxpayers deserve to know where the money's going. They deserve to know that that entity is viable. They're entitled to know that that money, in fact, went to the right place. So that's not... when we asked that from our rescue squad, it wasn't that we were coming up with some requirement that other rescue squads are not doing. It's that we needed to see that information for all those reasons, and that essentially puts the request on Foursquare. Now, in terms of providing audited financials, we think that's a very important factor. However, when we did the qualifications for this solicitation, we did not want to mandate that as an absolute requirement so that you could submit a proposal, because if we did, our own rescue squad would seemingly not be able to submit a proposal, and we did not want them not to be included. To the extent that they're not able to do that or choose not to do that, that'll be a factor we consider when we look at the proposals from hospitals or other rescue squads. In answer to the resident's question, you know, why, when I guess she and her family over the past several years made 4 calls and rescue squads other than Amwell Valley showed up, I imagine that that's because our squad was not able to, and the squads, our local squad has agreements or has had from time to time with other squads through mutual aid that those squads would respond. So the way it's been is you're not always assured that the local squad is responding. And in fact, when we've looked at the numbers, it's only turned out that our squad's responding to less than 50% of the calls. And we've had discussions with them about how they could get more EMTs, how they could get other assets so that they would be able to handle more. And over the past years, those numbers, you know, haven't risen, you know, past that essentially 50% point. So we're at a position where our local squad isn't able to handle more than those, but we want to see what they propose and what other squads propose, because bottom line, we insist that if someone has a medical emergency, an ambulance is going to be there. So that will be part of the factors that we look at. And I guess the final comment that I at least want to respond to is that it seemed to one of the residents like it was a slap in the face that we had, not given a donation for, 2025. And I'll go back to what our ongoing discussion that we had with our own squad, and we told them that, we need to see your audited financials before we give out money. Again, all the other squads do that. In fact, other municipalities that I'm aware of won't have a contract or allow service to be provided until they get to see that. And I recall writing a letter, I think, following up on one of the Township Committee meetings, I think it was July of this year, saying, look, for the record, we're not getting all the reports we've asked for, the information, and we haven't gotten financial statements. The statements we got were, some QuickBook entries that have no review by any CPA. And so they simply don't have a lot of weight. So we said, we're not going to be able to consider a request for a donation that you've made until you provide that information. But it's been about 6 months and, we haven't gotten that. So it's definitely not a slap in the face. And again, our logic is we need to know where money's been going and where money would go before our taxpayer monies should be sent to any particular donation. So it's the opposite of that. It's a due diligence on behalf of our residents. So to the extent that there was confusion out there, I hope these comments clear up that confusion. I don't know if anyone else has a comment that they want to add to any of the residents' comments today.
I do. You want to add to that?
Yeah, I just wanted to add briefly. I know a resident said they felt like this came out of the blue. And I just want to state, I think this really started when I got a letter when I was sworn in as mayor about 2 years ago from our mutual aid partners expressing their concern covering East Amwell and if that was sustainable or not. So we have had them here at meetings. We've had Raritan here, we've had Lambertville here, we've had Hopewell here at numerous meetings discussing this for the past 2 years, trying to think of a solution and what we can do. And I understand there are a lot of emotions involved around here, but what one of the residents said is we're supposed to be acting in the best interest of this town, and that's exactly what we are trying to do. I take that job very seriously, that I've been elected to do it in the best interest of this town. So that's why we are doing this bid process and seeing what we can do to make sure our residents are covered with EMS services. I mean, I think about this constantly, wanting to make sure that our residents have EMS coverage when they need it, but that we are also responsible with the taxpayers' money, especially in this economic time. So we are doing very diligent work to serve this community in the best interest possible.
So, ma'am, I think the answer in the red hat, I don't remember your name, but you mentioned about 4 calls to your house in not Amwell Valley. Typically, the way it works is it goes into the county dispatch center, and if our squad isn't available, it goes to mutual aid. All right.
They didn't all, they said it was based on more like the need, what they thought it would need. In other words, if it was a stroke or something, that would be different. So that's how they qualify who got called.
Well, I think the confusion on that is you're talking about ALS units versus BLS units.
I'm sorry.
You're talking about an advanced life support unit from the hospital versus a rescue squad. There's a difference.
Possibly.
Yeah, so that's how you got the paramedics. All right. So what I think Jenna tried to mention, so this isn't coming out of nowhere. This has been a conversation we've had for 3 years. A lot behind the scenes with the rescue squad and others, and as much as possible here. Because there was no need to bring all the nuances into public light if we can work it out. So when Jenna got appointed mayor, Dr. and I had gotten elected, we had received a letter immediately from the Flemington Raritan Rescue Squad, from the leadership, that we're no longer going to be interested in helping you guys as a dual alert first responder. All right, the letter's in the record. Linda got a copy of it. I'd have to dig it up. So what that means is, and this is important because it's complicated, which is why it's very hard to explain it. But there's what they call mutual aid, right? If we're not available, then the next town over will pick it up. That's typically done not as a regular course of business, as like, hey, we got a call going on, our ambulance is out, We got 2 calls at one time. The next town over is going to pick it up. Flemington during COVID, because we were handling less than 30% of our calls at the time coming through COVID, and you could jump in if somebody wants to correct me on that, but that's the numbers I was told. So Flemington's like, look, we're doing almost 70% of the work in East Amwell, and your rescue squad's not communicating with us, all right? They're not telling us what their plan is, when they're going to be staffed, when they're not going to be staffed, because we need to staff our rescue squad. Same with Lambertville. And these folks have been here. Their leadership has been here talking to the public, all right, about these problems. So they said, look, we'll respond mutual aid, but we're not going to respond dual alert. All right, that's a big deal when you have a rescue squad that's handling less than 50% of their calls. All right, why is that a big deal? Because if we go dual alert, which means as soon as Amwell gets the call, so does Lambertville and so does Flemington. If Amwell's not staffed, nobody, at 50% of the time, nobody's going to respond. So now Flemington and Lambertville, depending on where it is in town, they would come out immediately when the 911 call comes in. All right. What they were planning on doing is dropping only to mutual aid. So I'm going to throw numbers out there, maybe 5, 7, 8 minutes of re-alerting Amwell Valley before the neighboring town will pick up that call in mutual aid. All right, it's very common practice. It happens. So our partners in Flemington and Lambert were like, listen, we're your neighbors. We're going to help as much as we can, but we need a plan. I said, all right, how do we get together and make a plan? Let's get all the leadership of the surrounding towns, Hopewell, Flemington, Amwell Valley, and Lambertville at a table. At the first set of meetings, a guy named John Mills was on the committee. Him and I attended for about a year. There was different leadership in Amwell Valley. And we kept looking for a plan. Not me, not us, right? Because we don't run the rescue squad. The only thing we can do up here is decide who provides ambulance services in East Amwell Township. All right. So our whole goal, was getting our partners to stay at the table when they were at the time willing to say, listen, we're going to go into mutual aid only, not dual alert. Does everybody understand what that means now? Does everybody have a general idea what that means? That's a big deal, right? If we're here 50% of the time and our neighbors are like, we're going to help you, but only on mutual aid, not dual alert. That's very important. So we met at Amwell Valley Building with all the leadership, almost 2.5 years before things kind of broke down, and I'll get to that. Different change of presidents, different change of chiefs. There was the first chief was like, look, as long as I'm here, I'm making 80% of the calls, I'll keep it up and running. Well, he ended up retiring, moved on, and chose to do something else. And then we started meeting with Paul, and we kept asking Paul for a plan. Not me, not Mike Dennis, not East Amwell Committee, the neighboring rescue squads. And time after time after time again, they're unable to provide a plan for these guys moving forward on, we're going to be staffed. It took about, I don't know, anybody could jump in if you want, a year and a half, maybe 2 years into it before they came up with a staff plan to share with our partners. So our partners knew when we were staffed, so they knew how to cover their stations, right, to help us. So everybody, you're talking about our local squad, but you remember this, for several years, it's 50-50, whether you're gonna get Amwell Valley, Lambertville, or Flemington. All right, so we need them. We can't, this doesn't work without them. You guys understand that, right? This doesn't work without them. So we met, and then they finally drew up an agreement between Amwell Valley, Lambertville, and Flemington, where Amwell Valley now pays Flemington and Lambertville a fee every time they have to handle a call in East Amwell. What's unfortunate that there's a fee, but what's fortunate is they're responding at the same time as if it was their own call, right? So they're not going into mutual aid. So that's very important. So people mentioned about delays. We've Oprah requested, and we've gotten the numbers. The numbers of response times from Lambertville, Flemington, and East Amwell are all within seconds. They're not different. And those records were entered into the record also. And I can print out other copies too, and you guys can get them. So it's disappointing. I find myself disappointed of the misinformation that's been put out there. All right. About a month ago, I circulated something through Linda and our website. Questions that were being asked of me, being involved in this, and I'll read it here. Read it in here for the record again. And it's what I call a fact sheet, right? A fact sheet. Let me get to it. Just give me a minute to read it. All right. So on why the township has passed a resolution seeking bids for emergency services.
I'm sorry, Mike, whose fact sheet are you reading?
It's my own. I wrote it.
Thank you.
all right? It's mine, it's signed by
I just want to
me.
make sure people follow you.
It's a fact sheet that I developed over the last 3 years of meetings. All right, why is East Amwell Township reviewing Amwell Valley Ambulance Corps? Township has a responsibility to ensure that emergency medical services are reliable and that the taxpayer funds are used appropriately. A multi-year review identified ongoing concerns related to staffing, coverage, governance, and financial transparency that require further oversight before public funding can be approved. Is the public's, this is point 2, is the public safety currently at risk? No. The township through Amwell Valley Ambulance Corps has proactively coordinated with neighboring municipalities to ensure uninterrupted emergency services so residents continue to receive timely EMS response through a combination of local and neighboring rescue squads. So oftentimes when you call 911, you're 50% of the time you're getting Flemington and Lambertville, and then another 50% of the time you're getting East Amwell. Point 3, is Amwell Valley still providing services in the township? Yes. 100% of EMS calls are being answered in East Amwell Township. Amwell Valley continues to respond to some emergency calls. However, due to staffing limitations, it currently handles approximately 50% of East Amwell emergency calls, while neighboring rescue squads handle the remaining. Point 4, why is the township concerned about funding? Amwell Valley is requesting the same level of funding, of municipal funding in prior years, despite responding to significantly fewer calls. The township must ensure that any allocation of taxpayer dollars aligns with actual service levels, operational capacity, and accountability standards. 5, why is the township requesting financial records? Certified financial records are standard practice when public funds are involved and are routinely requested by surrounding municipalities. These records allow the township to verify that taxpayer money will be managed responsibly and in accordance with accepted financial practices. To date, those records have not been provided. Point 6, the township has identified and documented instances in which an administrative officer with a recent felony conviction is for stealing from another not-for-profit organization, while township believes in second chances. The involvement of individuals with such histories in administrative and financial roles requires heightened scrutiny to ensure taxpayer funds are fully protected. I took an oath up here, fiduciary responsibility. Before I can give out one taxpayer dollar, I need to know where it comes. It needs to know where it's going. Tim Matthews brought up that point that we had a conversation after. So if I have a concern about that, and I speak for myself, the rest of the committee can speak for themselves. How do I overcome that concern? Financial records. This is a red flag. I have a problem. I identify a problem. How do I overcome it? Give us certified financial records. They refuse to do it. That's a red flag to me. That's concerning. I have great concern about that. What is mutual aid? Okay, so something everybody wants to talk about is mutual aid. I tried to cover that a little bit. Mutual aid is intended as a safety net for extraordinary or high-volume situations. It is not designed to serve as a routine substitute for adequate staffing. Neighboring rescue squads currently handle about 99% of their own calls without requiring mutual aid, demonstrating sustainable operations. Every rescue squad and every police department in New Jersey is going to require mutual aid at some point. But not when it's 50% of the time, it's no longer mutual aid, it's a partnership. It's important to remember that. Has the township tried to work with Amwell Valley? Yes. The township has held multiple meetings, requested documentation, offered opportunities to collaborate over the years. These efforts have not resulted in a viable plan to address staffing shortage, equipment replacement, or long-term sustainability. These are meetings amongst the chiefs. Like, what is your plan? Like, when are you going to have enough staff to be on your own? And we've never gotten that answer. All right, number 9 is kind of redundant. Who's providing EMS service? Amwell Valley responds to approximately 50% of the calls, while neighboring rescue squads with long-standing records of professionalism providing coverage to respond to the remaining 50% of emergency calls. The township is grateful for the decades-long continued partnership with these organizations. What is the township's goal moving forward? As stated in the beginning, the township's goal is to ensure that every resident receives reliable emergency medical service and that any organization receives taxpayer funds, operates with transparency, accountability, and sustainable staffing. Public safety and physical responsibility remains the township's top priorities. So these are questions that I've generated through this process. This has gone on for years now. At some point, Amwell Valley has named me the villain and wrote a letter from their attorney to have me removed as liaison to the rescue squad. All right. What qualifies me uniquely for this? 30 years in law enforcement. All right, I have a background in this world. I understand the world. If the mayor so requested that I not be the liaison, then I'll step down as being the liaison. It doesn't change my questions, right? I just had a 45-minute conversation yesterday with their president. There's an ongoing dialogue. I don't know what these requests for professional services are going to bring. I have no idea what they're going to tell us. I don't know what Flemington's going to offer. I have no idea what Lambertville's going to offer. I have no idea what Amwell's going to offer. So as this process was going on, the mayor had suggested, let's put out a request for a professional service agreement. It's the most transparent way we can do this, right? We're already getting Flemington and Lambertville 50% of the time anyway. It's been going on for decades. It's not new. So to say these are strangers and we don't know these people, that's just factually inaccurate. A lot of statements are made about the cost. I don't know what the cost is going to be. I don't know. You know, I have ongoing concerns about, again, a plan, right? What's it going to cost? When are you guys going to need to replace an ambulance? What's your plan to do that? They don't give it. They don't give it to us, right? So the $25,000 donation that everybody's stuck on, we're going to ultimately, as the taxpayers, are going to have to make up that shortfall because an ambulance is $250,000. If that's the plan, if that's what the residents tell us to continue to feed this organization, then that's going to be for these folks to vote. But we have a responsibility to continue to look for a service that's going to be viable. We also was announced to us in 2024 that they were closing. Right here in the meeting, they were sitting right about behind you, ma'am. Treasurer said we're closing at the January 1st. We had to make plans. We have to make plans. Our friends told us they were willing to walk away from us. So how do we got to make plans. We lose our friends, we got nobody, right? So I find myself more disappointed than frustrated that members of this organization have chose to attack us, to attack me, to attack others, and to spread false information. They don't have the facts. We don't know what it's going to cost. Has anybody seen a bid from Flemington? Has anybody seen a bid from Lambertville? Has anybody seen a bid from East Amwell? So to say it's going to cost more money, that's just not factual. We don't know what it's going to cost. To say response times are going to go up, well, they're already here 50% of the time. Nobody's complaining about response times, and we have the records that show the times are within seconds. So I don't know where that problem's coming from. It's manufactured. I'm here. I stayed after to talk to Tim Matthews and others last week. My phone's on. The president of their organization, I have a dialogue with him. I don't know what's going to happen here, to be honest with you, but I know for sure we have to have a rescue squad. So where that's going to go, I don't know. And I think the mayor's suggestion of a request for professional service, that puts it all out there for you guys to see. Like, hey, what are we getting? What are we getting now? And what can somebody else offer us? Right? I think that's fair. I'll be happy if we're not going to talk at this dialogue, I'll be happy to stay after and talk to whoever wants to continue to talk about that. But that's all. Thank you for giving me that time, by the way, to put that out there.
Thank you for providing us with that information.
Okay. Do you guys want to mention anything, or are you good?
Yeah, I just want to touch on the piece of, volunteers. We appreciate that our squad is all volunteers. And the question of forming, more of a partnership with the other organizations has come up in the past. It's unfortunate that when you look across the country, what I've been told is there's not a lot of 100% volunteer squads out there. It needs to be supplemented. So, that's one of the things that we keep trying to bring to the table. Can you merge? Can you have a formal partnership? But again, the mutual aid agreement may not be the answer. That may not be sustainable for the other organizations. So how do we make it work? Can you merge with one of the other groups? I mean, we've had those discussions over and over. No one wants to see the local volunteers go away. But how do we make it work?
Bev was at a lot of the meetings I was at, and these folks were offered to merge into Lambertville, Flemington, even Hopewell. They'll take them with open arms. They refuse to do it. Every suggestion that was brought up of a way forward, they just simply refuse and say, give me my money or else. Give me my money or else. Well, give us a plan. Give us a certified financials. The money's here. We didn't spend the money. Everybody has a conspiracy how we're transferred the money's here. The money's gone nowhere. How do we give the money when they won't tell us their plan? How do we give the money when they won't show us their certified financials? Wouldn't that be due diligence? Wouldn't you expect that out of us? I don't think we give money to anybody else without looking at their financials, do we? That's not unreasonable.
Yeah, but I don't know how we make a full volunteer squad to cover us 100% of the time work when it's not working anywhere. So how are we supposed to make that happen? I think the best you can do is have, you have to merge with another group. I don't know how you do it without, you've been trying to build up the squad, but, it's difficult. And it's also, we mentioned before, and I don't know how the whole system works, but when you talk about the level of service, sometimes you may be getting the other squads because they can handle the situation better. There's so many factors, and I don't know all the factors. There's a lot of questions that we have out there. I don't know how the system works, but that's another reason why, if there's a call, if Amwell Valley is available in staffing, but it's something that requires a higher level, even if there's staff, it may go to someone else. So, there's so many very complicated issues. So when it's being argued on Facebook and there's all different spins, I think that's a disservice to our residents. Because everyone's panicking.
Leaves me disappointed that leadership of this rescue squad chose to do that. All right, and I shared that with the president, and he felt that it wasn't his position to stop it. I think Rob Connor's a great guy, brand new to this world. But when supposed professionals put out disinformation, that's concerning. That when they know, and a lot of the disinformation was about the bid process. I had to talk to our clerk on a night off during the holiday break because of the amount of disinformation that was put out there. And she took her time, on her own time, to correct the disinformation. All right, that's not right. You guys know, you know the truth. So that's just wrong. That's to scare people to get them here. What Bev is talking about, all these things came up in these productive meetings that we were having. But every avenue that we pursued, Amwell Valley said, no, we're not doing that. Talk about bringing in talk about a hybrid system, go to a billing system. No, and they had 50 different reasons why they can't do that. And it's complicated. I'm not saying it's not. It's more complicated than I can educate anybody from here in the next 5 or 10 minutes. But we've talked about every way forward, right? Because the volunteer model, it's not their fault. It's nobody's fault. Who volunteers for anything anymore? Nobody, right? Nobody. It's hard. We were told by all the leadership, for every 10 candidates they get, 1 is likely to stay. All right, so we're running with, I saw something, you guys are running with about 9 active EMTs, maybe more members, but 9 EMTs handling calls. You probably need 20 to 30 to handle 24/7, 365. All right, where are these people coming from? They're not, they're hard to get. It's a lot of time, it's a lot of commitment. So we've offered many ways of finding homes for everybody that wants to serve the community and work with the leaderships that are leaderships of Hopewell and Lambertville and Flemington, who are more stable financially and more stable staffing-wise, right? But they said no every step of the way. What can I do, right? So what options do we have when the ambulance squad that we have in front of us is struggling to meet the qualifications of 365, 24/7, and our partners are like, dude, we're here to help, but we're not here to prop you up without a plan. That's the problem, right? If our partners leave us, we got nothing. And our partners are pretty stable organizations that are already doing 50% of the work. So you guys are smart people. Give me a suggestion. I'll run with it.
Can I speak from here?
I'm sorry, it's not a discussion. Let me say...
It's not a dialogue. It's not really a dialogue.
Yeah, and let me just remind folks, hopefully this helped clarify some of the questions that are out there, but to your point, this is why we made this a public, open process. Come to the next meeting. Everyone's questions are welcome. Everyone will see what the proposals are. They'll be able to evaluate, and you can help us evaluate, what we should do with that. Because as Bev said, as Mike said, these are not simple issues. The models are difficult, finances are difficult, viability is difficult. It's complex, and we just need to make sure that whatever decision comes out of this, it's the one that's going to protect our residents the best. So come back, remain part of the process, everything will happen in front of you, you'll have all the information that we can offer. All right, anyone else have, Al?
And I haven't been part of the process like Mike and, Bev and Dante talking to the rescue squad over the last 2 years that I've been, serving our township. So, I'm just gathering the data from, the board here, you guys, but, when these bids come out, that's when it's showtime. And I'd really like to see all the data from everybody, and then I can do my own analysis on response times and whatever other plans are out there. That's where I can make, an educated decision. So, it's my 2 cents.
Okay. All right, so any further business this evening, any new business from members? All right, seeing none, may I have a motion to adjourn?
So moved.
Second? All in favor? Aye. Passes unanimously, thank you. We're closed at 7:50.